Okay, welcome all to the ESG outreach program overview. So, excuse me, we have somebody open and coming in. Good morning.
Good morning.
We have started our recording and we're going to go ahead and move forward with the presentation. So,
I understand.
So ESG CV guidelines and resources. Here's a list of the information that we pulled for this, which is available to you. And I will send a copy of this presentation to you, so you'll have the copies of the links for your reference. So the purpose of these funds for ESG Solution Grant Funds, COVID funds, is to be used to prevent, prepare for, or respond to coronavirus pandemic within Clark County. Available funds contracted to subgrantees must support households who are experiencing homelessness. So for these funds, and you want to state this in your policies, they should be related somehow to responding to COVID in some fashion. I would suggest that the fact that you're working on getting people housed and off the streets is a response in and of itself to COVID. So program should be, but make sure it's stated in your policies. If you can make the connection, that would be helpful. So program should be housing focused and working towards connecting those experiencing homeless with the Housing Solutions Center. Responding to COVID may also include, masks, hand sanitizers, soap, and providing other services related to health, such as transporting people to medical appointments. So must be consistent with CDC guidance related to street outreach. So ESG funds may be used for providing essential services necessary to reach out to unsheltered homeless people. So these are non-facility based services. So if somebody is coming to a facility, then it wouldn't be considered outreach as far as these funds are concerned. So it should be non-facility based. So, and again, as you're familiar with unsheltered homeless people are those who are going to be receiving the service as defined under HUD paragraph 1.1. So a private place not designated for or ordinarily used as a regular sleeping accommodation. So for this program, we are going to require that you use the street outreach, the ESG CV street outreach forms as a verification. It's really simple, one pager. You just check the box and put their name on it and HMIS number and date. But there's a little bit of guidance on there on what kind of information you can utilize to determine eligibility. So you must verify, describe, and document eligibility housing status prior to program entry. Documentation of housing status must be recorded. This should include a written observation of their living conditions by an outreach worker, already existing HMIS street outreach services record, or self-declaration. So the outreach worker who witnessed or who is going out and providing the service, if they witness them in an encampment or witness their living situation as being homeless, they can be the one to verify that. They can go into HMIS and indicate that so it's not necessary unless you have an ability to actually seek out an additional outreach worker to verify that. So HMIS entry, you must provide an audible history of entering. What that means as far as audible history is it should describe the nature of the transaction and information to support it, which includes the person who entered the data, the date of the entry, explanation of the housing status, and it should not be changed or overwritten once it's inputted into the system. So you can use HMIS to record that information, but it does have to be clear and meet this standard. So backup documentation, this is going to be something important to share with direct service provider, direct service staff, is that third-party written verification is first and foremost, if possible. The thing with outreach, though, is that the outreach worker who's going out and witnessing, the service provider who's going out and witnessing may be actually serving as that third-party verifier. So,
hey, Tom.
Yes.
So for share, we're only going to be doing this for the people that we're doing intensive case management with, not for everybody that we see in an encampment.
Okay. And we are gonna get to that part. There's a difference between light touch services and then those you're providing intensive case management services. And we do want to keep those separate. And so that's a good differentiation. Yes. So, so you might, if you're not seeing somebody who is literally in an encampment, like you didn't go to the encampment and see them, you saw them in some other fashion, you're going to have to be able to provide some kind of additional documentation, probably from another outreach worker who has witnessed it at some point. Now that could be a written verification from them, or it could be, if you're not able to get that, then you would move for some reason, maybe because of COVID, you're not able to get the information, then you would move to a third-party oral verification from that outreach worker who has witnessed their housing status. In some cases, just because somebody is obvious on the street doesn't necessarily mean that they're sleeping on the street. So it is important to obtain verification. And then the last resort, if you can't obtain any verification, then you would resort to a self-declaration. So source documentation is first and foremost. So you must do your due diligence in obtaining source documentation. You must document clearly in a file that the steps were taken to obtain the ideal verification based on the order of preference that is listed above, and why you were not able to obtain it, and only then move to the next best option, such as a self-declaration. So, and then also indicate the barriers that were in place and that caused it to where you weren't able to get that initial third-party verification. So, sometimes people will just write that right on the form itself, like if which would be sufficient, or in their notes, in the case notes. Here's an example of both a third-party oral verification that for ESG-CV, and also the self-declaration form. So allowable costs. So activities to locate, identify, and build relationships with unsheltered homeless, provide immediate support interventions, and connect with homeless assistance programs and our mainstream services, such as the initial assessment, crisis counseling, addressing urgent physical needs, providing information and referrals. And then the case management piece should be housing focused. This is similar to what you were describing, Amy. Assessing housing and service needs, arranging, coordinating, and monitoring the delivery of individualized services to meet the needs of the participants. Using coordinated assessments, tools, and evaluations, counseling, coordinating services, monitoring, evaluating progress, referrals to other providers, developing a housing service plan. Again, this should be housing focused. Other allowable costs: transportation costs of travel by outreach workers. Travel takes place during services to those experiencing unsheltered homelessness, transporting unsheltered people to emergency shelter or other facilities. Also includes program participants' travel on public transportation, mileage reimbursement for program staff, accompanying or assisting program participants to use public transportation, and transporting participants to and from vaccine events. Other allowable costs are, birth certificates, social security cards, other identification expenses required to obtain housing and critical services. That is housing focused. So, mobile electric devices for staff, food, clothing, basic need items. And so for those type of items, the basic need items, agencies must include all those items in your policies and procedures. And if you forget to put something in there, and if your policies have already been approved, just go ahead and send an email. And once it's approved, you just have to, you can go ahead and just add it to your current policies and procedures. So bus passes, over-the-counter medications, masks, again, masks, hand sanitizers, and soap. So backup documentation, all essential need items must be supported with appropriate backup documentation when submitting invoices, vendor name, date of purchase, amount of purchase, description of items purchased, date provided to client, and an HMIS number. So emergency physical health and mental health services, so must have prior approval from the county to provide these services. The hesitancy on providing these services is that if those services are available elsewhere, they should first be utilized there. And so this would only be an option if there were no mental health or physical services available for them. And of course, it would probably take someone who's licensed to be able to provide that. So unallowable costs, if persons are coming to the facility to access essential services, this would not be considered street outreach. If persons are coming to a facility to receive case management services, this would not be considered street outreach. So hazard pay, volunteer incentives, outside agency training, retailer or merchant gift cards, vouchers, and certificates. So I did have a question previously about facility. So if you have a ongoing case management going with somebody where they're coming into the office, that would not be considered street outreach. That would fall under case management services. If you are out in the field and for some reason you're trying to help somebody and for some reason you are needing to access the facility to be able to better assist them, then there is some flexibility there. It just should not be, they shouldn't be coming to you for services. So that's the main thing. So not all items listed in the Commerce ESG guidelines are 24 CFR 576 will apply. So refer to your contract, the Clark County ESG Q&A, which I'll be sending out, or this presentation for allowable and unallowable expenses. We do encourage you to, of course, review the guidelines by Commerce, but keep in mind that there may be some county limitations on what's approved. And then you can reach out to myself if you're unsure. Our other county staff, Beth's well knowledgeable about ESG programs also. So intensive case management services. So light touch services versus an intensive case management service. So light touch, you don't see them very often. It provides essential need items, referrals, and maybe some transportation. Where intensive case management, you're developing a housing plan. Meetings are more frequent, transportation to services to get needs met or access housing. And there should be a ratio of 25:1, no more than that, to try and help support, transitioning off the street into housing. And then case management must be low barrier with housing first orientation. Intensive case management service should be housing focused, is equivalent to the household's level of need, and utilizes strategies and best practices to engage households such as assertive engagement, client-centered, trauma-informed, and equitable access. So, developing housing and service plans. So referrals to mainstream resources, goal-oriented, should be client-centered, client choice, based on assessments of the household's barriers and needs. Not all clients are readily open about, immediately open to share the information about their barriers. So that might be an ongoing process. Housing focused, and then have goal dates. So it's not uncommon to see housing plans without dates, or if there are dates that just a goal that continues on and on. And it may be that those goals need to be broken out into smaller goals, more realistic short term. And so that's something when I'm reviewing the files that I'll be looking for. So HMIS, we currently have a meeting scheduled to talk to Dale about HMIS and how we're going to differentiate light touch services with those who are intensive case management services. It will be helpful that shares doing just intensive case management services, because that'll make it a little bit easier, but we do want to have that availability for light touch services. And so we're looking into that. And as soon as we have more information and more direct guidance on how that's going to look, we'll be sure to update you on that. And of course, the HMIS release is required, and then information should be updated within 10 days of entry into the program or by the 5th of the following month, whichever occurs first. And invoices will not be paid until HMIS data is complete. And that's the motivation around, one of the motivations around getting it done by the 5th, where the 10-day entry is more of a following best practice in as far as HMIS is concerned. So.
Hey, Tom.
Yes.
In terms of HMIS and the idea that ESG doesn't pay for everything, would you guys be comfortable if we have a client who were serving with ESG, who were also serving with other county funds, other outreach county funds, and then they're in HMIS in both programs, if that's the case?
So if they're receiving intensive case management services, I would not suggest that would be the case, though. That they, if as long as they're not receiving it from both, if they're receiving light touch services from one and intensive case management services from the other, that would be more realistic. And I will double check on that, but I don't see any reason why that would be an issue.
I was thinking in terms of flexible funds, that they things that might not be allowable under ESG that we could, yeah.
Yes, that's yes, exactly. Are you referring to the ARP funds?
I am.
Yes, exactly. That, and I think that would be just fine.
Thank you.
You're welcome. Other important information to know. So exit clients from the program after 6 months of no contact. Assuming that we've attempted to contact them. Chronically home, so you must participate in the CVNL, and then increase the number of coordinated entry housing and vulnerability assessments that are conducted. So you should increase the number of trained staff who are able to do those assessments. And then you should be coordinating with the Housing Solutions Center and helping clients connect with those services. And services will be flexible and include late hours, such as evening and weekends as needed. And I think we've had conversations with both agencies regarding this, so I appreciate your flexibility on that. And then hours of coverage will include at least one weekend day and evening. Other important information to know is invoices are due by the 15th. The invoice for the period ending June 30th is due by July 8th. First draft of your policies and procedures should be submitted to the county within 10 days. So hopefully this presentation will help you in developing those. I think if you can get those to me as soon as you can, that would be helpful. Annual and quarterly reports due by the 15th of the following month. I'll be working on those really shortly to get those first drafts to you. And in additional due dates, please refer to your contract. There are quite a few other dates on there you might want to pay attention to. So these are the ones I wanted to highlight. And then policies and procedures must include a reference on how funds will support COVID-19 response efforts to prevent, prepare, and respond to coronavirus. Coordinate entry policies, termination, denial, grievance, confidentiality, order of priority for obtaining documentation, which we mentioned earlier in this presentation, and then feedback from our survey, feedback/survey information. Here's what the Q&A looks like. I will be sending this out. I think it's backwards. I think the left side is on the right and the right side is on the left. But this is for the presentation's sake. This is not the entire Q&A. There may have been updates since I posted this, so I will send this separately. And I think that's it. So I'm open for questions if anyone has any. And
I do have one question about the facilities. We are in the process of developing a space where we can meet with people inside. And so I want to get some clarification on are we allowed to pursue that, or?
So if you are having them have to come into the office to do case management, like a scheduled appointment, that would not be considered outreach. If you are outreaching to them and it is somehow needed that you have to utilize the facility to print out forms for them or use a computer, because somehow the computer, if you're remotely using a computer and there's nowhere to sit that's comfortable, or you're not able to access internet, then it seems reasonable, if it's housing focused, that you can bring them into the office and provide that. But we don't want to have to make them come into the office and have otherwise it's no longer outreach at that point.
Okay.
Yeah, unfortunately, ESG is a little strict on that, and they're very clear about what's considered street outreach. Well, we would definitely like to see this program be housing focused as much as possible as a response to the pandemic. Oh, you know what? Now that I quit recording, I can share my video. Any other questions, clarifications? Great. I have this recorded. I'll be sending it out to you, and you can always send me follow-up questions if you have them. Half hour, we're doing pretty good. So you get another half hour of your time back. Yes.
Before we all say goodbye, just one thing that I'd like to add about light touch versus intensive services. Since in the presentation we mentioned frequency, like light touch is infrequent. It isn't only based on frequency, it's also based on what kind of service you're providing. So if as an outreach services, what the point of the interactions is basic day-to-day survival kind of thing, water, socks, hygiene, first aid, stuff like that, that's going to be light touch. So, even if you're seeing that same person on a regular basis, if that's the context of your interaction, you are not doing housing focused intensive services. It might be part of your relationship building, but that would be light touch. Does that make sense? Okay.
Thank you, Michael. That was very helpful. Any other questions and follow up with any questions for myself or Michael?
So Tom, like the deal is generally that we would provide these policies and procedures 10 days after execution. For us, it's been longer than that already. And I thought I saw an email from somebody about that we had a little more time. What, are you just expecting these as soon as possible, or?
Yes, please get to them as soon as possible. I know that the 10 days has expired at this point, but at least the first draft would be great. And so if I was to give you a timeline, I would say by the end of next week. Would that be sufficient?
Yes. Just gonna say yes, and then yeah, so
Okay.
that it'll be like magic.
Okay. Great, thanks. And then reach out if you're having any struggles with it, or any clarification to help, so you can help write them up. So
Thanks, appreciate that.
okay. I have to say though,
Tom, can I say something?
Yeah, please go ahead.
For Adam and Ren's purposes, because we're new at this, I would recommend that we definitely provide a draft of a policy as soon as possible to Tom by next week. even if it's in draft form, so that he can take a look and they can kind of say, yeah, this is where you're going in the right direction, or what else might they want to see in a procedure and policy. We already have procedures that we've been using in our shelter. This is a different ballgame altogether. So I think I would just encourage them to do that as soon as possible.
And that's a good point, Saeed. Like, it doesn't have to be perfect. I mean, we can work on it together. If when I review it, we can make notes. So I'm gonna go ahead and stop the recording unless somebody else has questions. I don't want to miss out on recording those.